Good afternoon, folks. Thank you so much for joining us today for our webinar. I'm happy to welcome you to the third installment of our webinar series titled Environmental Health Data Webinar Series. My name is Reem Tariq. I'm a Senior Project Coordinator at the National Environmental Health Association, and at NEHA, I manage programs that focus on federally unregulated drinking water, climate and health, as well as some of the emergency preparedness projects that NEHA has ongoing. As part of this webinar series, NEHA has been working in partnership with the Virginia Department of Health on how to use environmental health data to make data-driven decisions. Our webinar today is titled Best Practices for Amplifying the Impact of Food Service and Retail Inspections. This webinar will share how health agencies can understand both the current state of health inspection data from the perspective of private sector customers and opportunities for improvement. The webinar will share insights on 4 general principles that are fundamental to inspection data publication, which is online data availability, ease of access, timeliness, and detail and accuracy. Our speaker for today is Arash Nasibi. Arash is the CEO and co-founder of Seattle-based Hazel Analytics, where he has led the transition of the company from a university research project to a leading technology company that is moving the needle on food safety and public health. Hazel's technology is used by over 200 global and national brands, including Starbucks, Target, Uber Eats, and Yelp, to proactively monitor public health inspections at over 700,000 outlets in the US, Canada, and UK. Prior to founding Hazel, Arash had a career in management consulting and was also a founding member and CIO of StudentMentor.org. He holds an MBA from UCLA Anderson School of Management and a Bachelor of Science in Computer Science from UCLA. Before I turn it over to Arash, I do want to cover a few housekeeping items. Please note that this webinar is being recorded. The recording to this webinar will be placed on the NEHA's website 2 weeks after its completion. As far as questions for this webinar, just know that we will be holding all questions until the end of the webinar, that is after the presentation. If you do have any questions though, feel free to put them in the Q&A box or the chat box, and we'll address them towards the end. Lastly, there is going to be a survey that will pop up as soon as you X out of this webinar towards the end. Please do take that survey because your feedback does help us in improving future offerings. And with that, Arash, I'll turn it over to you.
Thank you, Reem. I'll go ahead and share my screen. All right, that should be sharing now. Mm-hmm. All right. Again, thank you for that introduction, Reem. You did quite the masterful job, so I suppose that all that's left for me to say is good morning or afternoon, depending on where you all are. The title of the presentation is Best Practices for Amplifying the Impact of Food Service and Retail Inspections. That's obviously a mouthful, so what exactly is it that we're going to be talking about? I'm first just going to spend a couple of minutes talking about Hazel and our impact on public health. I think it's important that we do that because it'll help underscore the value of the inspection work that your agencies are doing and how it can span far beyond the borders of your particular jurisdiction. And next, and this is where we'll spend most of our time today, we'll do a deep dive on the 4 core principles that we've outlined for health departments to consider in order to improve actionability from their public health data. If you are interested in learning more about the private sector use cases, we actually did a presentation at the NEHA Annual Conference in Spokane about a month ago that we did jointly with the food safety team at Cheesecake Factory. And that was more of a presentation from the perspective of private sector. So just wanted to plug that presentation if that's interesting to you. It's sort of related content just from the other side of the table. So with that, I think Reem did a pretty good job of introducing Hazel, so I won't add much here. Again, we're a Seattle-based company. Our mission is to improve public health by effectively connecting food service operators, consumers, regulators, all for the purpose of driving action. We have over 200 brands using our platform. Some of the logos are listed here. In terms of our database of health inspections, we have over 18 million inspections and counting across 3 million facilities and counting. And over the years, we've been fortunate and proud to receive recognition from both the food service and retail industries for our innovation in food safety. I mentioned that we were born out of university research, and the genesis of that is a particular paper that two of my co-founders, Ginger Jin and Phil Leslie, did when they were academics at UCLA in the early 2000s. They effectively studied the effects of LA County introducing restaurant letter grades in the late 1990s and wanted to know what the impact was on foodborne illness. And what they found was that there was a 13% reduction in the years following that change in system. And this benefit has been more recently reproduced on an even bigger cross-jurisdictional scale. The research we're highlighting on the right was done by University of Minnesota, where they actually found a 61% reduction in foodborne illness in jurisdictions that require the posting of letter grades at point of sale. Just to call out, the evolution of our company, this paper on the left is what kickstarted it all. Phil and Ginger continued doing more research related to health inspections and health departments. And in 2010, got research funding to create a centralized database of health inspections. And that's ultimately what turned into Hazel Analytics when we commercialized that research in partnership with UCLA and the University of Maryland. Just to explain a little bit about how it works and what we do, it's best to describe in sort of three component parts. Starting at its most foundational is our data collection. We're collecting data from over 1,000 health departments across the US and Canada and UK. We collect about 2 million inspections per year, or roughly 7,700 per business day. We collect about 95% of the data that's digitally available in the US, and we have similar percentages for Canada and UK. And once the data comes in, we're standardizing it. That's the next step. Standardizing means a couple things. In its more basic sense, it means making the data look and feel the same so that, as an end user, you don't feel like you're interacting with 1,000 different data sources. But perhaps even more importantly, we're enriching the data. And this is where we use AI, like machine learning and natural language processing, to make the data more useful than its raw form. Some examples of this would include filling in inspection types when the health department doesn't publish them. So for example, distinguishing between a routine and a re-inspection. Mapping violations to a common standard like the FDA food code, or devising standardized scoring systems to allow for cross-jurisdictional comparisons. And finally, we're rolling all of this up into user-facing software and products to make it easy and maximize actionability for a number of different stakeholders. Speaking of stakeholders, this is a great bird's eye view of sort of the various stakeholders we serve. Starting at the top, you see food service operators and retail operators. We have over 200 major brands that serve millions of people every day using our platform. And these are places that you've likely eaten at yourself in the last month, if not the last week. We also work with Yelp, where we power health scores for over 700,000 restaurants to give consumers the ability to make more informed dining decisions. And we also work with food delivery companies like Uber to use our platform to verify the legitimacy and compliance status of their restaurant partners. And of course, with each of these stakeholders, while their individual use cases may vary, they're all rowing in the same direction of protecting public health. I wanted to focus in on the food service operator use case a bit more. This is the lion's share of our users. So these are typically corporate food safety professionals at chains. It's hard to estimate precisely, but something along the lines of 1/3 to 1/2 of all restaurants are operated by chains. So this is not an insignificant slice of the food service ecosystem. And of course, the larger a chain gets, by proxy, the more people they serve and the more complex their food safety and compliance becomes. So these are just some of the use cases that our corporate food safety teams see when they use our platform. So it's things like just having inspection visibility, what's going on the ground at their various locations, better identification of risk. So being able to parse through the higher risk inspections and violations from those that might be lower risk, performance rankings so that they can, understand where their, trouble facilities or regions lie, getting more insights into what the top violations are that they're receiving, benchmarking against competitors and other types of executive reporting, and perhaps most importantly, corrective action management. So actually taking action on the data that they're seeing in order to improve outcomes for subsequent inspections. I'm just going to highlight a very quick example here. This is a leading national full service restaurant chain with hundreds of locations that you've undoubtedly heard of and likely eaten at. Prior to using our platform, they did not have a formal system in place for monitoring and completing corrective actions on health department inspections. And by using our system, they've been able to implement such a formal process, and it's become sort of the building block of their active managerial control and broader food safety culture. And the way it works is, when an inspection comes into our platform, we automatically trigger a corrective action for any critical violations, and those get assigned to the restaurant manager that's responsible for that location. And optionally, the corporate food safety team may also assign corrective actions against non-critical violations, sort of using their judgment. Regardless, the restaurant manager will complete any submitted corrective actions. Area leadership and corporate food safety will review those, especially during their site visits. And the corporate food safety team can take any follow-up action and coaching as needed. Obviously, this is a very simplistic, high-level overview, but it kind of gives you a broad sense for how that works. And in terms of benefits, this is the same restaurant chain we were just talking about, comparing the roughly 2.5-year period before they started using a platform like ours to the 2.5-year period after. They've been able to realize some meaningful improvements in their food safety metrics. Their average criticals per inspection are down 17%. Average total violations are down 9%. Their re-inspections that result in one or more violations are down nearly 20%. And their average Hazel score, which is basically our standardized score for an inspection, is up 9%. So the impacts are very real and very tangible. Now, how can health departments, likely most of you, help in unlocking some of this value from your food safety inspection programs? And it really just boils down to various considerations when it comes to posting information online. And so the 4 core principles we're going to discuss today is 1, online data availability, 2, ease of access, 3, timeliness, and 4, details and accuracy. And just for the record, we've outlined all of these in a free white paper that's available to download on our website. That white paper discusses this in much more detail than I'm able to do on this presentation today. So I would really encourage you, if you're interested in checking that out. So let's start with principle number 1, online data availability. A position I sometimes hear from regulators in different jurisdictions is, we have a FOIA process, why not just make a public records request? And what I would like to emphasize next is, why that, may work in some cases, but doesn't work for most cases. And we want to focus on digital online data for 2 reasons. The first reason is that it's an effective use of agency resources. It's scalable. So a single published report online can be consumed, in theory, by an unlimited number of stakeholders without the agency personnel needing to field separate public records requests. So it's much more of a push model rather than a pull model. It's also more inclusive. Although records requests are technically available, not everyone may have the resources or the know-how to go about doing that. So that can be a barrier of entry to many people and consumers. And finally, it's more timely and efficient. As a requester, you don't really have a way of knowing whether the data you're looking for, let's say the most recent inspection for a particular restaurant, is even available yet, right? So you may be making a request for a report that doesn't exist. So not only are you wasting your own time, you're perhaps more importantly wasting the agency's time by fielding a request for data that doesn't yet exist. The second reason is that manual collection hinders downstream consumption of data at scale. So without having digital data available, things like benchmarking analyses, trends analyses, other types of machine learning are completely impossible. You just can't do it. So having the data available at scale digitally unlocks a lot of that potential. Finally, when you're having to do transcription by the consumer, of course, that's duplicative because every consumer is going to have to do that for themselves, and it's also error prone, which can cause all kinds of problems downstream. So when we look at where digital data is available, mind you, this is as of last summer, so things may have changed a little bit, but approximately 79% of the US population lives in a jurisdiction that does publish inspections online. A notable update and exception to this visual is that Maine started publishing inspections online late last year. And in fact, we're in the process of bringing that information into our system. So definitely want to give a shout out to the state of Maine for doing that. And something we want to also call out here is to mind the data publication gap. This is obviously a cheeky play off of Mind the Gap from the British subway system. But we do observe health departments that are actively publishing data online, sometimes going offline. And this could be for reasons like switching a technology vendor where you're switching from one database to another, or any number of other reasons. We saw quite a bit of this during the pandemic, understandably. But what we're citing here is really pre-pandemic stats. This is all through April 2020, July 2018 rather, to April 2020. And we had a total of 177 occurrences of health departments interrupting their reporting. And we found that in 48 of these cases, the downtime exceeded 3 months. So basically, the public didn't have visibility into the inspection data from those jurisdictions for over 3 months. And you can imagine that, downstream impacts that has for folks like corporate food safety professionals that, are no longer able to have visibility into those inspection results. So let's talk a little bit about core principle number 2, which is ease of access. And here we want to actually take this in 3 component parts: data fragmentation, search friction, and data consumability. It should be a secret to no one on this call that with over 2,500 health departments across the US, we have some states that have, several local health departments within them. So when we look at the distribution of states by the number of local health departments, 8 have basically 1 primary agency, 12 of them have 2 to 9, and then 31 states have 10 or more agencies, and 17 have 50 or more. This would be the Texases and the Massachusetts of the world. Now, despite having several local health departments, some states alleviate this issue by aggregating and publishing their data in a federated manner. So examples of states that do this are Alabama and Oklahoma. So even though they have multiple local health departments, there is a state level portal where each of these health departments feed their inspection data into, which makes it really easy and convenient for consumers to access that information. And of course, publishing data in this manner doesn't have to be an exclusive choice. There's still room for the local health departments to publish their own data in addition to taking a more federated approach. Next, let's talk about search friction. What we observe is that most health departments do offer some form of a search portal for users to interact with their inspection database, but the user experience of these search portals vary dramatically. And of course, if you're a food safety professional or anybody else who has the need to access, say dozens, hundreds, or perhaps even thousands of records, the difference between a single click and multiple clicks and steps can have a really outsized impact. So while search interfaces might seem like a simple technology because they're very ubiquitous in our daily lives, I'm sure you can all appreciate that not all implementations are created equal. For instance, a search interface that requires the use of very strict keywords can create a very frustrating keyword guessing game for the user, right? So you gotta get the precise address right or the precise spelling of the restaurant right in order to generate any results. In addition to the actual input part of the search, which is the user inputting what it is that they want to search for, we also find a lot of variation in what the searches return in terms of the results. Ideally, you want to return individual pages with a unique URL. And less ideal is returning individual pages without a unique URL. And even less ideal than that is returning multiple historical inspections on the same page. So again, in an ideal scenario, every health inspection would be published at a unique permanent URL that makes for better downstream record keeping. And we find that 31% of agencies don't provide a static and unique URL. So that was ease of search friction. Let's talk about data consumability. So what data publication medium is the best? Well, a very good place to start is well-structured HTML and tables with predictable formats. Just to be clear, this does not include PDFs. Even better would be a bulk data download and/or APIs that will offer machine-readable formats. These would include, CSV, which are very conducive to, pulling things into Excel, for example, or JSON, which is even more sort of machine-friendly. Best, of course, would be having the both, right? Best of both worlds. The well-structured HTML will likely be more beneficial and appeal more to the everyday sort of individual consumer, where the machine-readable formats will be very helpful to bulk users like researchers and folks like ourselves. And finally, in case it requires calling out, worst would be PDFs. These are very difficult to do any kind of analysis on, especially handwritten scans, which is probably self-evident. So in terms of ease of access, let's just recap the key considerations we talked about. We talked, number one, about data fragmentation. So publishing data from multiple jurisdictions at a state federated level can significantly ease access. We also talked about search friction and how not all search portals are created equally. And similarly, how returning results in a structured way with individual pages having unique URLs is a best practice. And finally, in terms of data consumability, bulk APIs and download options are great, followed by well-structured HTML websites, and to try to avoid handwritten PDFs whenever possible. All right, let's talk about core principle number 3, which is timeliness. This one may perhaps be the most self-evident, but I'll just recapitulate the concept here and provide some data to back it up. So first of all, in terms of the lag time from the date of an inspection happening to the date that it gets published on the corresponding health department's website, here's what we observe. About 43% of jurisdictions will have a lag time of 2 days or less, which is great. 38% of jurisdictions will take 3 days to 6 days, but still less than a week. Not bad, but of course could be better. And then we have 21% of health departments where, 19% where it's more than a week. And in fact, there's 6% where it's more than 15 days. And this is where the actionability rapidly starts to taper off for folks like food safety professionals and other consumers. You can think about it in the context of re-inspections. So when we study our own data, we find that in terms of the number of re-inspections that are triggered after a failed routine, 84% of the time it's just one re-inspection, and then they pass their re-inspection, and there's no subsequent re-inspection or second re-inspection. But in 16% of the case, there are more than one re-inspection, right? So 12% of the time it's 2 re-inspections, and 4% of the time it's 3+ re-inspections. Now, by having the data be available in a timely manner, and I'm sure you all know that the typical re-inspection timing is anywhere from the next day to 7 days out, 2 weeks out. We've even seen it as late as like 30 days, maybe a little bit more out from the previous inspection. So by publishing the data in a timely manner, that allows it to reach the relevant stakeholders in time so that they can review that information, make the necessary changes in order to have a higher probability of passing their re-inspection. Of course, that's not just a benefit to public health, which is first and foremost, but it also helps save valuable resources on the part of the health department agency. I'm sure you all would like to do fewer re-inspections and not more, given the limited resources that you already have. So that is on timeliness. Next, let's talk about the fourth and final principle, which is details and accuracy. First, I just want to highlight sort of data availability in terms of details. These are not an exhaustive list by any means. That goes for everything we're going to discuss in this section. Again, the white paper will have a lot more in it. But the amount of detail that's available is significantly impactful on the types of actions and insights that the downstream consumers are able to derive. And this is not relevant on just a per inspection or a per facility basis, but also through large scale changes like employee training, vendor selection, and other processes relevant to food safety. We've seen, customers of ours, these large brands, change the way that they're training their employees based on trends that they saw in the health inspection data, or swap out a chemicals vendor for another one based on inspection violation data that they saw in our platform. So this type of information can really drive meaningful change. And again, first, it requires that the data be available. So what are some data attributes that are high value, and what are the corresponding rates that we see them being published? So inspection type, thankfully, is pretty common. 88% of health departments publish that. So this is labeling inspections as routine or follow-up or complaint. Now it's still disconcerting that there's 12% that don't, but I still feel good about the fact that the vast majority do. 72% of health departments publish violation comments. Again, this is really rich contextual information for the end user to have in order to be able to root cause what the issue is beyond just the violation type. About 50% of health departments will publish an inspection result or score. This is sort of the equivalent of a consumer-facing score, like the letter grades in the LA County. 43% of health departments will provide overall inspection comments. These are more the sort of freehand, totality of the visit remarks that the inspector will make. That can include a lot of contextual clues or relevant information that maybe wasn't directly tied to a specific violation line item. And finally, in terms of closure outcome, we find that only 15% of health departments publish this. And this is perhaps the most disconcerting. Closures obviously are kind of the worst thing that can happen to a food service operation. Means that they had issues that were so severe that it required the health department to shut them down temporarily until they got those issues resolved. And having that visibility, not just for consumers, but even more importantly for food safety professionals that are mandated with managing these operations, is really a missed opportunity. So it's great to have the data, but it also needs to be accurate. So let's talk a little bit about accuracy. And when it comes to errors in health inspection data, we find that they can often be traced back to just human error as part of the data entry process, or other times it's bugginess in the software that the health department is using for publishing the information online. And of course, it can be a combination of the two as well. So next, I want to step through some concrete examples of do's and don'ts for some commonly observed fields. And we're going to touch on fields related to facility information like business name and address, fields related to the inspection itself, like the date and time and inspection type, and also violation level information. And again, this list is by no means exhaustive. In the white paper, we outline many, many more fields and provide do's and don't examples of those fields. So let's start with facility information and something as simple as the business name. So in the table here, we're outlining kind of do and don't examples. So don't, for example, abbreviate or misspell or use incomplete names. So in this first example, we're looking at clearly, to a human eye, you can tell that that's referring to an international house of pancakes, i.e. IHOP. But to a machine, that would be very difficult to interpret. Instead, use the complete DBA name whenever possible. So Subway, Starbucks Coffee Company, Bravo Cucina Italiana. The don't example of Bravo Cucina was just Bravo, right? Which is very much shorthand for that restaurant name. Don't use just the legal entity name. So oftentimes when a restaurant gets permitted, it's being permitted to the legal entity, not necessarily the user-facing restaurant name. But again, for downstream users, that restaurant name as it appears to the public is what's most relevant, more so than the legal entity. So ideally, you include both. So Sencal Subs, the DBA Subway, right? So it's a franchise group called Sencal Subs that's operating a Subway. Similarly, Cowabunga Inc., DBA Domino's. So just having the legal name can be very difficult and misleading because you actually lose track of what the underlying restaurant is. And last but not least, using limited identifying information in multi-location situations. Airports are a great example of this. Most airports have multiple Starbucks, for example. So saying just Starbucks main terminal or Starbucks departures isn't very helpful when there are multiple Starbucks in departures or multiple Starbucks in the main terminal. So best practice here would be to be as specific as possible. Starbucks, Terminal C, Gate 12. Starbucks, Terminal C, Gate 33. So that's a little bit about business name. Next, it's very helpful to also include a unit number. This is most relevant, of course, for chain-based operators, because they internally will use that as sort of their primary record. So this is going to be an incredibly helpful data point to include. And we're showing some examples of that on the screen. In regards to street address, the best practice here, of course, is to align the address as closely to U.S. Postal Service standards as possible, which would include the full number of the address, using standardized formatting for addresses in terms of North, Avenue, et cetera, including the city, including the state, the zip codes, et cetera. What we find particularly problematic in terms of the don't examples are just using cross streets or the nearest intersection. So, Wrangell Hill Road and Red Lion Road, not helpful from a data consumption perspective. Perhaps even worse, using incomplete or incorrect formatted addresses. So just Union Street and not having a number. And PO boxes, of course, are a big no-no as well, because those are not very helpful. Okay, so let's look at some inspection related fields. This is more of a records sort of data publication level consideration, which is having a unique identifier for each and every inspection. This is particularly helpful in disambiguating inspections that happened on the same day, whether it was a reinspection, let's say there was an inspection in the morning and then a reinspection in the afternoon. Just understanding that those are two separate inspections and not the same or potential duplicate is very helpful. And also very helpful in multi-permitted settings where, let's say it was a grocery store that got inspected and there was a separate inspection for the deli, the bakery, and some of the other facilities within the grocery store. So having those individual unique identifier are really helpful. And we're showing an example here from Washington County. The date and time of an inspection is also very valuable information. I mean, the date for obvious reasons, but the time can be very helpful as well. And we find that leading health departments will include that. We're showing some examples here from South Carolina and the Sussex County Department of Health. The inspection type, again, hugely important. Understanding the difference between a routine and a reinspection and a complaint makes a massive difference for the users that use our platform in particular. A reinspection obviously inherently implies that there was an issue with the previous inspection, and a complaint, is the member of the public, citing a concern. Whether it can be a substantiator or not is a different issue. And oftentimes we do find that, complaint inspections result in no violations because whatever specific issue that the complainant observed can't be, replicated by the inspector. But, just knowing that there have been complaint inspections is really valuable because oftentimes we'll see patterns, right? It's, multiple consumer complaints being filed against the same facility. In terms of violation information, having the violation code and text is sort of table stakes and very important for our users to have. Absent that, it's hard to standardize and understand, say, for a given facility, let alone a group of facilities in a jurisdiction, understanding things like, what are the top violations being cited. Having that sort of standard violation code is really helpful. And the violation text, of course, provides that little bit of extra contextual knowledge to kind of root cause any particular set of issues. Last and certainly not least, the severity. So, calling out and making it clear whether it was a critical or a non-critical violation, as is the example from the city of St. Louis that we're showing at the top of the screen. Other health departments will use the priority foundation core language to designate and differentiate severities. Whatever your jurisdiction is using, just encouraging you to make that explicit and published so that the users on their end know where their critical issues are so that they can focus on those in particular. So to bring this to a close and wrap up, I just wanted to very quickly recap what it is we talked about in terms of the core principles. First and foremost, online data availability. None of this matters if the data is not online. So that's sort of the core thing to start. Second, it's making the data as easy to access as possible, especially keeping sort of bulk users in mind. Third is timeliness, right? So timeliness is king. The sooner that data goes online, the more actionable it becomes. And fourth, it's not forgetting about details and accuracy. More detailed, more accuracy, that'll all serve the end users well. And the last thing I'll say is that this is all in line with the FDA's new era for smarter food safety blueprint that they've been championing now for about 2 or so years. And I've just copied some excerpts here from the blueprint around establishing and working with multiple stakeholders to analyze big data, That's really what we're doing at the core of our mission, engaging with different partners in a broad coalition, and finally to creating public-private data trusts, which is also sort of core to what we do. So the era of food safety has smarter food safety has already begun. It's here. So we just need to kind of chip in to do our part. So with that, I just want to thank Neha for hosting me and giving me a forum to speak here today, and all of you for listening, and I'll gladly take some questions. Daniel is asking, do any companies use your software to track internal audits? Historically, and as of today, no. We've been very razor focused on kind of doing the best we can with public health inspection data. But that being said, kind of having reached a certain level of maturity with public health inspections, we are looking at ways actively to overlay the internal audits, because there's a lot of interesting correlations and calibration questions to ask there. So short answer, not as of today, but I would expect that in the coming year, we'll be doing that. Charles asked, what are some of your recommendations for data mining for agency and commercial clients? Can this be done at a large scale level to analyze for improvements to national standards? Great presentation. Thanks, Charles. I'm not entirely sure what Charles means by recommendations for data mining. I mean, that's what we do. We're collecting data. I mean, again, when APIs and bulk download options are available, that's a gift from the heavens, and that's our primary approach. But absent that, we've developed data crawlers that will use the search interface in order to pull the information. It's not easy to do. We have a team of about 4 data engineers that their primary responsibility is to develop those data collectors and manage them. So that's a very technical discussion, and Charles, if you want to have that more offline, I'm happy to connect you with our engineering team to kind of get a download on how that works. And yes, I mean, one of the benefits of doing this at the scale that we're doing, again, we're collecting 95% of the data that's digitally available in the US, is that it can highlight, whether it's at a state level or regional level or at the national level, improvements to national standards. What we see, even when we look at an individual state and different jurisdictions within the state, their enforcement behavior can vary dramatically, even with 2 neighboring state counties, for example, in terms of what their top violations are that they tend to cite, in terms of how many violations they cite, period. So calibration issues like that are great to interrogate and ask of the data. Daryl is asking, where does Hazel Analytics stand on the Lives data standard? We don't have a strong opinion on that. For those that don't know, Lives is the data standard that Yelp has helped and tried to usher in as of, I think, 2013 or so, in some part in collaboration with public health agencies. In other parts, they're just taking public health data and conforming it to the Live standards themselves. I think it's perfectly fine. I think it's noble that they're trying to develop a standard, period. In the absence of there being a federal or national push on the part of government to do that, seeing the private sector do it, I think is at least interesting. That being said, we as Hazel Analytics don't have a particular opinion on it one way or another. Donald asked, does the FDA make any recommendations for database features and configurations? Not that I'm aware of. We've talked to the FDA in the past. We're continuing to engage with them. We're hoping to see that. That being said, a lot of the FDA's focus, as I'm sure you all know, is just around uniformity of food code adoption, period. And I think how that translates into data publication is a secondary and tertiary concern. Of course, personally, I would like for it to be part and parcel of the same conversation, because the uniformity of enforcement practice and behavior is only so valuable if it's not being reflected in the data that's being published. So short answer, I haven't seen any recommendations yet, but I would love to see them. Douglas is asking, can you elaborate on the topic of data standardization? For example, what assumptions do you have about each state adopts the FDA Model Food Code as a regulatory foundation? As you may be aware, not every state uniformly adopts the most current, right? Moreover, many states modified and more. Yeah. So I'm acutely aware of that, and that's one of the, let's call it, problem areas that our company was founded on to try to solve, is the fact that not only is data fragmented, meaning that it sits with multiple thousands of health departments, it's also that these health departments can kind of put their own spin on the FDA food code, be it a version from 1995, or in the case of California, just not adopting the FDA food code period and having their own. So the need to standardize arises in part from that, so that if you're, say, Starbucks corporate food safety, and you're trying to understand, nationally or in a given region, what are your top issues, you need some form of standardization to do that. So what we do internally, in part, is we map everything. When I say everything, I mean all violations from all jurisdictions to the 2017 FDA food code, and that provides a proxy for our end users to be able to do that kind of cross-jurisdictional comparison. I hope that answered Douglas's question. Cindy asked, I missed the first part of the presentation, so this may have already been stated. Do you circle back to the health departments to ground truth assumptions made? For instance, we send reports to the operator within 3 days of inspections, but don't post until 7 days after. This allows a short period to correct inadvertent mistakes clarified. Is this reflected in the pie chart with posting dates? Good question. So in terms of what we would be considering the start and end time of that, posting period, would be whenever it hits the health department website. So based on the example you're citing, Cindy, we would be using 7 days, not 3 days, as like the publication time. And we know that health departments will oftentimes publish updates to inspection records. Let's say that there was a rightful challenge to something that was cited or miscited, quite frankly, and the health department subsequently updates a record that's been already published. We will capture those updates, and that'll be reflected in our system as well. So it's not just that we're collecting information once and then never looking back at it. We have a look back window, and I think it's 90 days. So anything that's been updated in the past 90 days by the health department will get reflected on our platform. I hope that answered your question. Brian is asking, has Hazel Analytics considered incorporating pictures from inspections in its data collection? Short answer is no. I would have to check with our data team. I don't think this is very prevalent when it comes to regulatory health inspections. At least I haven't in recent memory come across a health department that published inspections along with pictures. That being said, a lot of our customers who use our platform for conducting their own corrective actions against health department violations, they want to use pictures of the corrective actions that they're taking, right? So, be it, I'll just use a simplistic example of filling up the hand soap dispenser or some other kind of physical thing that you can take a picture of. But on the regulatory side, we currently don't incorporate pictures, and moreover, I can't say that I've seen a health department that actually posts pictures. It's a great question, though. So to that end, I'll also just say, my contact information is on the screen. If I'm not able to answer your question, I can always route you to someone on our team who can. Kanita's asking, how can we view the recording? I think that's more of a question for you, Reem.
Sure. So we will be placing the recording on the NEHA website about 2 weeks from now. So be on the lookout for that. But if you do need access to the recording sort of prior to that, I'm happy to provide a link to the Zoom recording. So Kanita, you can connect with me. I will be sharing my contact information towards the end. In fact, you know what? I'm going to just drop it in the chat. In case anyone needs to connect with me regarding the recording.
Cindy's asking, will the white paper be posted with the recording? I have no issue with that, Reem. I don't know if you have a way of facilitating that on your part, but I can give you a PDF copy of it in case it's helpful.
Great question, Cindy. We'll definitely have the white paper be posted along with the recording. Thank you. All right. Any other clarifications or anything from your side, Arash? Anything you want to mention?
No, again, just want to thank everyone for not just their time today, but you know, the broader work that they do in the service of public health. We're all on the same team, or at least trying to achieve the same objective in protecting public health. And I hope I just illuminated a few different things. And I don't think most of these things are difficult, especially if you're already publishing data online. You know, I would amount most of these things to tweaks rather than wholesale changes. And I know there's a lot of technical jargon in there, which can feel intimidating, understandably. And you know, we're happy to, you know, kind of do just consultations and work with the regulatory community. We don't have any business with the private public sector, so this is not something we're looking to, you know, make money from. It's really just benefits everyone involved to do some of this stuff. So feel free again to reach out offline, and we can see if we can help you out.
Great, thank you. Thank you, Arash, so much for the insightful presentation, for answering all the questions. I want to thank all the attendees for joining us, and for all the folks that asked questions. With that, I just want to remind folks that we do have another webinar, the fourth installment within the series tomorrow, which is scheduled for, let me just confirm here. Also, or not also, I should say 2 p.m. Eastern tomorrow. And we're going to be hearing from Washington State Department of Health on their climate and health program. So I hope you do get a chance to attend that. I'm going to go ahead and drop the registration link in our chat here, just for easy access. And lastly, I just want to remind folks that as soon as you do exit out of this webinar, that survey will pop up. Please do take the survey so we can improve the webinars that we will be continuing to offer on NEHA's end. Thank you so much, and hope to see you tomorrow. Thanks.
Thanks, everybody. Thanks, Reem.